Hi, this is Christine Sørensen. I'm a health literacy trailblazer. Thank you for listening. Today, I want to share a reflection about why health literacy is like a starfish. And the idea came some time ago when I was a keynote speaker in a workshop in the Netherlands. And we were listening to one of the other keynote speakers. He was an ambassador from a local adult learning association, and he was telling his personal story about living a life without letters. And you have to imagine, we were like 100 people, professionals, students, teachers, um, at a higher education institute, and we were all holding our breath because we were so fascinated about the way he was telling his life story. His story was so captivating because for more than 40 years he had kept it a secret to the world that he could not read. And he told us that his wife had helped him to cope and manage, but when she passed away, he realized he was really in need of help. But he felt such a deep shame and stigma, um, because he had never really learned to read. His school years had been a nightmare, because there he was considered lazy and dumb by many of the teachers, and he was bullied by the other kids. And as an adult, he had actually tried to ask for help, but he was neglected. So he just kept it for himself and learned to cope in many other ways. But to this day, it really cost him a lot of stress. He could not read the medication instructions. He hated filling in forms, and really, when seeing his general practitioner, he kind of got overwhelmed, and he hated entering hospitals. But then, can you imagine? After 40 years, he reached out for help, and he got it, and his life changed for the better because he now reads and he helps others to gain the same gift late in life. You could see it when watching him. He looked empowered, he was happy, he was committed to change the situation for himself and for others. It was just an incredible impact, and we were just, all of us were under the impression. And I think for me that story was really a reminder that we're simply not always doing as well as we could. I mean, think about all the people and professionals he had met during his whole life, which could have helped him much earlier to a better life with much less suffering. Much can be achieved by peer educators like the health literacy advocate we met, but we really need a systemic change to happen if we really want to make a change. We need health literacy champions within the health system, within the educational systems, who can help address the root causes of literacy as well as health literacy. Um, and those are challenges we face even today in our modern welfare societies. He was a living example of this. And it also reminded me that the health literacy investment and capacity building is always bi-directional. We can on one hand focus on the individual, but we also need to design the societal response of the health professionals, of the teachers, of the civil servants, of policymakers that put in place to actually facilitate the health and social services for the public good. But still, even today, people are falling between the 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 chair, so to speak, in the cracks. There are cracks. Um, And so when we afterwards, in the panel discussion at the end of the day, we were reflecting, one of my colleagues said, "Oh, yeah, do you remember the story about the starfish?" And I said, "Yeah, yeah, yeah, I do. I very often use this in my teaching." And the story goes like this: it's a girl walking on the beach, and she on the seashore, and she finds a lot of starfishes, and she starts to throw them back into the ocean. And then a gentleman passed by and asked him, why are you doing it? Why are you throwing all the starfishes? And she says, I want to save them. And he's like, look at this, there are so many. You will never ever be able to save them all. But she says, well, I made a difference to that one. And then she continued working. And I truly believe we can apply this approach that the little girl is doing, to health literacy. Nurturing people's health literacy and help them live a fulfilling life is one of the best gifts we can share with the world. And we see from this gentleman's life story how we can actually help people one by one. And also, he showed us that it was never too late. We can always help our local teams, communities, municipalities, hospitals, schools, governments, one by one, to make a structural change towards organizational health literacy by daily incremental actions, by being kind, by being able to listen, by discovering people, seeing them when they need help, and helping them to cope and coach them to cope with their health literacy challenges. Health literacy should health literacy limitations, personal or systemic, should never ever be a barrier for people to gain a healthy and flourishing life. And I learned also from that day that we should not be discouraged to act, despite the magnitude of societal health literacy challenges and our health literacy challenge and the literacy challenge that we face. He really showed us how health literacy can bring hope and help for people to own their own situation and be empowered, both in terms of the people that we try to help, but also among ourselves. We were all taken away by what we heard. I included this small story already of the starfish in my latest book called Health Literacy is Like a Rainbow, and you can order it on my website if you want more small stories. Otherwise, I usually help organizations implement health literacy by design, so get in touch, send me a direct message if you want me to help your organization too. Thank you for all you do to promote health literacy for all. Have a nice day and see you in the next video.